Hello everybody, and welcome to Species Specifics. Today we're going to be discussing hamsters. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I have also included some diseases that are not mentioned specifically, but still may come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. There are only a few notable diseases to remember about hamsters for the NAVLE, so I have put them in no particular order. We will start with antibiotic dysbiosis. Like many of our pocket pet species, hamsters are highly susceptible to dysbiosis after antibiotic use. This typically allows proliferation of Clostridium difficile, which can produce enterotoxins. Clinical signs of this condition include diarrhea and death within 3 to 5 days of antibiotic administration. Treatment primarily focuses on supportive care, and prevention involves avoiding antibiotic use whenever possible. Proliferative ileitis is caused by Lawsonia intracellularis. This condition is most common in young hamsters. The major clinical sign is diarrhea, which is sometimes referred to as wet tail. Treatment involves antibiotics, and prevention is typically not necessary, as most hamsters will develop resistance to this pathogen by around 10 to 12 weeks of age. Tizer's disease is caused by Clostridium piliforme and affects the liver of the hamster. Clinical signs include diarrhea and sudden death. This disease doesn't have much for treatment, as most cases are subclinical until death occurs. The disease only really causes clinical signs when the animal becomes stressed, such as from overcrowding, parasite load, poor nutrition, etc. So avoiding stress in hamsters is very important. Amyloidosis is another stress-related disease in hamsters. This condition primarily affects stressed older hamsters, resulting in hepatic and renal amyloid deposition. The main clinical sign is weight loss. Treatment involves supportive care, and prevention focuses on minimizing stress. Polycystic liver disease is commonly observed in hamsters over 1 year of age at necropsy. This condition occurs due to developmental defects in the bile ducts, and it is not associated with any clinical signs or consequences for the hamster. Lymphomas and epitheliomas can be linked to hamster polyomavirus. Young hamsters typically develop lymphoma from this virus, while older hamsters develop epitheliomas. These present as palpable masses throughout the body and are often seen on the skin. Once the disease becomes enzootic within a hamster population, tumor rates tend to decline. Cutaneous lymphoma can also occur in older hamsters, unassociated with hamster polyomavirus. Clinical signs include weight loss, anorexia, and patchy alopecia. The disease is usually rapidly progressive, causing death within 10 weeks of diagnosis. Finally, we have atrial thrombosis. This condition is a common cause of death in aging hamsters and occurs secondary to heart failure. Clinical signs include tachypnea, tachycardia, cyanosis, and of course, death. There is no specific treatment for this condition once it develops. Interestingly, androgen hormone levels appear to influence the development of atrial thrombosis, so castrating male hamsters can help reduce the incidence of this disease. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. Thanks again for watching, and we will see you in the next video.